Welcome back. I'm Dr. David Basista. Call me Dr. Dave. I'm very excited that you're here today. I've seen literally hundreds of people's lives change for the better through chiropractic care, and I know yours can too. Today you will receive your report of findings and recommendations, which will help you to better understand this exciting journey that you're about to begin on. Let's review some of the concepts you were introduced to during your last visit. Subluxations can cause a vast array of symptoms. If you have subluxations, they may very well be causing your symptoms as well as a host of other health problems. Or you may have no apparent symptoms at all. One thing's for sure, over time, if subluxations are not corrected, your health will deteriorate. If we can correct the damage to your nervous system, your subluxations, and their causes, you will likely not only feel better now, we may prevent problems in the future. This can reverse the effect of your aging process and allow you a better quality of life. That's the kind of wellness chiropractic care we specialize in here at this office. Let's talk about symptoms for a moment. Most people think of symptoms as being bad, and I can understand why. They're usually no fun at all. But symptoms are really very important. They let you know that there's a problem. Let's imagine you put your hand on a hot stove. If you didn't feel any pain at all, the only way you'd know your hand was burning is if you could smell the smoke. Ouch! That would not be good. People who have symptoms often take action to remove them without addressing the underlying cause. It's the have a pain, take a pill mindset. This kind of thinking is similar to hearing the smoke alarm go off in your home. Would you simply pull out the battery just to shut up the alarm, or would you locate the fire and put it out? Then why, when you have a pain, would you mask that pain with a pill without looking for the underlying cause and learning how to fix it so that you don't have pain in the future? We really need to understand that symptoms such as back pain, neck pain, headaches, digestive problems, allergies, and others are only effects. They are necessary, but usually just the tip of the iceberg to alert us of a far greater underlying threat. Stress caused by physical, biochemical, and emotional factors is the real culprit at the base of nearly every health concern. Stress leads to subluxations, improper nerve supply, interference, and damage. It's a lot like having a toothache. Just because the toothache started yesterday, this doesn't mean that it was the first time your tooth was sick. The degenerative process going on in the tooth took months, maybe even years, before you finally felt the pain, because that's when it finally hit the nerve. Let's say you went a whole year without brushing your teeth, and then you went to see your dentist. Can you imagine what your mouth would feel like and what the look on your dentist's face would be when he or she looked into your mouth? It probably looked like you had some sort of a carpet on your teeth. But even more important, the odds are you would have some serious tooth and gum disease. The dentist and hygienist would have quite a time cleaning your teeth at that point, probably having to deal with cavities and maybe even some more serious issues like root canals and other major procedures. Once your dentist got everything cleaned up and you had a mouth full of beautiful pearly whites again, would you go another year without brushing your teeth? Of course not. Once you corrected the damage, you would brush, floss, and get regular checkups to have healthy teeth for a lifetime. Just as with the dentist, our intent in this office is to help you correct the damage you already have. In other words, correct your subluxations and allow your body to heal and function as it was designed to do. Then, just as the dentist shows you how to brush and floss, we will show you how to quit recreating subluxations in the future. And of course, we will recommend you receive regular checkups to make sure your nervous system is free of subluxations and nerve interference. We do not intend to simply cover up your pain and mask the symptoms. We do intend to correct the causes of your symptoms to allow you to heal on every level, so there is no need for pain and symptoms. Symptoms are body signals that are there for a good reason. They let you know that something is wrong and change is necessary. In a few moments, we will discuss your health goals and different plans of action to help you reach those goals. To help us clarify exactly what you want to achieve, I want you to review this Path to Optimal Health chart. You can see it says it's wellness at the top and illness at the bottom. The important thing to understand is about this spectrum is that there are varying locations you can find yourself on at different times in your life, depending on your lifestyle choices and stresses. Not only does it matter where you are right now, but as importantly, which direction on the path you are. As we start down the path on the left-hand side, you see what reduces our health. Then we start up the path on the right-hand side, we can see chiropractic, wellness choices, and lifestyle choices that help to increase our health. The question is, what makes us go down the path? It begins with an accumulation of stress over time that our bodies are not able to cope with. What kinds of stress? Well, physical stress, the injuries that might be caused by things such as the birth process, sports activities, sitting too long in school and at work, repetitive type motions at our jobs, poor posture, car accidents, even a lack of appropriate exercise. All of these are physical stresses and they can cause injury. What about biochemical stress? For instance, poor diet or nutritional imbalance. You know that it's almost impossible today to get all the nutrients we need from our food? That's because our soils are so depleted. Heck, you can eat a purely organic diet with a wide array of different foods and still need nutritional support. We also live in a valley where you can see the air you breathe. And there's cleaning agents and all sorts of other toxins that we're exposed to on a daily basis. What about emotional and mental stress? We've all had that. And it could be anything from having a bad grade in school to having an argument with a friend or losing a loved one or going through a divorce or any other types of serious life crises. On the illness to wellness continuum, +10 is optimum health, +6 is excellent health, +2 is good health, and 0 is the comfort zone. As we begin down the path of illness, we may notice changes in our energy levels, ability to handle stress, quality of sleep, physical health and symptoms, also our emotional states. Eventually, we may go down to -2, which is fair health, -6, which is poor health, and eventually awful health, and finally death at -10. The great thing is that although we may have been going down the path most of our lives, we can always go back up the path. We can make healthier choices and begin the journey up anytime we choose. The real question is, can we make it all the way back up the path considering the damage we've done so far? To begin the journey back up the path, we just need to start making healthier choices. We need to get to the cause of the problem instead of just trying to get rid of the symptoms. Chiropractic care will help us to remove the damage and subluxations and make sure our nervous system is functioning at its optimum level. We may need also to make changes to our diet and get more exercise. We may need to address unhappy relationships at home and at work, and learn strategies to deal with emotional stress. As we begin to make appropriate changes and our nervous system begins to function as it was intended, we may begin to regain our health. Once we have corrected the damage and changed our lifestyles so that we don't keep recreating the same problems over and over, it's imperative that we get our spine and nervous system checked regularly for subluxations. Obviously, time and gravity are not on our side. And even though we're making healthier choices, it's critical to make sure we maintain proper nerve supply and function. Now let's take a look at this chart to get an idea of where you think your level of health is right now. Realize, of course, one can be very healthy, stub their toe, and feel a great deal of pain. On the other hand, we've all heard the story of the man who was never sick a day in his life, went to the doctor, got a clean bill of health, and died the next day of a heart attack. So we realize the limitations of this scale. We just want to get an idea where you feel your health is right now. Please put an X in the box where you feel you are right now. How do you know where to place it? Well, if you're in awful health and you feel exhausted, can't cope with stress, maybe you have insomnia, chronic disease, acute episodes and serious depression and anxiety, you're going to want to put a -10. Maybe you have fewer symptoms. Sometimes you're perhaps fatigued. You don't sleep well, but it's not debilitating. And on up as we go. Perhaps you're in the comfort zone where your energy level is okay. You have average amount of stress, you sleep okay, you've got aches and pains from time to time, but relatively you're comfortable. Maybe you've got good health. Mark whatever you feel is appropriate. And then I'd like you to go ahead and put a check mark in the box where you'd like to be. How healthy do you want to get? Do you want to just get out of crisis, maybe feeling better, and basically be comfortable? Or do you want to move more towards good health? Or even optimal health? If so, we must not only correct your present subluxations and nerve interference, but we must also show you ways to quit recreating these things over and over again. You must be sure that you eat well, move and think in healthy ways, maintain a healthy, properly functioning nervous system. Now, above the wellness-illness continuum chart, please write how long you feel it will take to reach that goal. Do you think it will take a few years or a few days? Please write the number of days, weeks, months, or years you feel it will take for you to get there. Realize that if you just want to feel better and get out of your current crisis, this will take much less time than if you are going to correct the damage and subluxations you already have, make appropriate lifestyle changes, and truly reach optimal. Now let's get back to the right-hand side where it says increasing health. At any time, we can make healthier choices and begin our journey back up the path towards optimum health. So please, check off any areas you feel you need to change in your life to achieve your health goals. Become subluxation free, have better strategies to deal with emotional stress, think healthier thoughts, begin or improve exercise, add nutrients, change your eating habits. If any of these apply to you, please check those choices. Next, think about the results you hope to achieve as we address your subluxations and you make lifestyle changes. What would you like to have in your health? Reduced pain and symptoms and feel better? Increased energy, more restful sleep, healthier weight, more happiness, less anxiety. If there's something else that you'd like to have in your health, check other and jot that down at the end of the presentation. Now in the upper right hand corner, please indicate on a scale from 1 to 10 how important the health and wellness goals you have set for yourself are to you, with 1 being the least and 10 being the most. Again, there is no right answer. We just want to know how important these goals are to you at this time. Finally, please write your name at the bottom of the page. One of the most difficult challenges our patients face is they often feel so much better so quickly. And if that's your goal, to only become comfortable, that's fine. However, if you stop care at this point, your subluxations will likely continue to worsen, and eventually your symptoms will come back. Obviously, over time, this can happen more frequently and become more intense. True, you can start care again and probably feel good once more. However, the more often this happens, And the more damage that occurs because of your subluxations, the harder it is to undo them. This is one of the reasons why we like to do checkups for children in this office, to clear up subluxations before they become serious problems. In just a moment, I'll begin to review your results with you and discuss your health goals. Together we can clarify exactly what results you'd like to achieve, and I can show you how I can help you get there and what you'll need to do. Remember, in our office you have choices. I look forward to seeing you in just a moment.